Hey guys, Matt here to help you review some high-yield respiratory pharmacology. Let's get to it. Histamine is an organic nitrogen compound that is classically involved in the allergic inflammatory response. The H1 blockers are reversible inhibitors of the H1 histamine receptor and are generally used in the treatment of allergies. There are two generations of histamine blockers, and they can be remembered based on their sedating properties. The newer second-generation histamine blockers were designed to be less sedating. More on this in a moment. First-generation histamine blockers include diphenhydramine, dimenhydrinate, and chlorpheniramine. When are they prescribed? These drugs are used to treat allergies, allergic rhinitis, acute urticaria or hives, and motion sickness, and they can also be used for sleep. Besides sedation, what other classic side effects do you remember for antihistamines? Exactly. Urinary retention, dry mouth, blurry vision, and delirium, among others. This is because of cross-reactive antimuscarinic effect. Also, some anti-alpha adrenergic effects like hypotension and dizziness can occur. Would these side effects be similar or different to the side effects of atropine? Very similar. Atropine is a common antimuscarinic used to treat bradycardia. Toxicity of these antimuscarinic drugs classically results in increased body temperature, urinary retention, flushing, and delirium, so these drugs should be used with caution in older people. Second-generation antihistamines include loratadine, fexofenadine, desloratadine, and cetirizine. Like the first-generation antihistamines, they can be used to treat allergies, but are more favorable for daytime symptoms because of the lack of sedation. Why do these drugs have less sedation than their first-generation counterparts? It's because they have less penetration into the central nervous system. Now for a flash quiz. Which H1 blocker is more likely to result in sedation, chlorpheniramine or fexofenadine? Exactly. Chlorpheniramine is a first-generation H1 blocker and thus will be more sedating. Always consider this difference when prescribing antihistamines to the elderly.